There's so many opportunities with innovation in technology. I think sometimes the technology gets ahead of the actual application and the practicality. People forget there's consumers and there's real clinicians who need to use the technology. And so just developing technology for technology's sake because it's cool and innovative, that's not the same thing as really taking the steps forward in the stride. So many problems that people are trying to solve in healthcare using technology and saying, great, digital is here, it's going to save the day for us, we've got mobile technology, etc. A lot of these things have been around for a while. We need to think about things really centered on the consumer, centered on the patient, and then think about how clinicians can actually pragmatically use these technologies to help with patient care. It's a fundamentally different way of looking at it. I'm a technologist at heart, but I don't think we can lead with technology. The best innovations will come with leading with the people who need to use the technologies, and that will provide the best solutions over time. One is really in the infrastructure of healthcare IT, and it relates to standards to improve interoperability. And so HL7 is a long-standing organization that's had a standard for healthcare IT that's evolved over the last 20 years or so. They have a new standard called FHIR, which should be a lot easier and promote quicker adoption and also more rapid interoperability. I think that holds some real promise in fixing, again, that infrastructure problem that we have in healthcare so that you can bring data together not only for clinicians to aggregate patient information on a single patient from a variety of providers, but also to allow data to come together so that it can be analyzed across larger populations and cross-sections or subsections of the population so you can really understand how to improve care, ultimately to an N of 1, down to the individual. So I think that's going to be a huge impact. It is the most difficult and hence the large reward if you've got a high risk of doing it. But I think we're on the cusp of it. A second category of innovations, it's not a single one, hopefully is around virtual care. There are a number of things that are happening that are exciting and interesting with smartphones and mobile technologies. I don't think we see the winner that's out there today and say, wow, this company's got it and it's going to be a winner-take-all category. But I think when you sum up the large variety of solutions that are out there, that'll be innovative, and then you get copycats and they'll all evolve. Most of the early players will probably lose. But the ones that evolve over time, the second and third generation solutions, somebody somehow are going to, organizations are going to get it right and in different segments. That holds a lot of promise. It's probably not in the next 3 years, but it's in the next 5 to 10. One of the complexities in healthcare is that there's so many different stakeholders that have very different points of views. An organization like eHeath is basically built on the idea of convening these multiple stakeholders and trying to understand what are win-win-win solutions for all the different parties. It's going to have to be something like that because that's what's necessary. And while I named a bunch of stakeholders, the one that's the most elusive is the consumer. And so we've got to bring it back to who is the consumer and how are they thinking about things. That's an area that at least eHeath, in bringing together the various stakeholders, can also try to help different groups focus on the consumer at the center.